I'm Ian Wright, Head of SCAP UK and Ireland, and I'll be discussing pet travel and importation of dogs, rescue dogs from different countries, both of those going up year by year, and a variety of exotic pathogens and vectors that we're seeing coming into the UK as a result. So I'll be discussing diagnosis, presenting clinical signs, treatment and prevention of these parasites, just to make us all that bit more aware and hopefully keep these parasites under control. It's like how my heart sings when someone comes in and they say they want a pet passport doing. Oh, well, that's just wonderful. That's absolutely fantastic. But, we're stuck with them in their current form for now. We may well miss them come January the 1st, but for the moment, the current rules for filling them out still apply. A lot of clients, but in my experience, some veterinary professionals as well, fundamentally misunderstand what the pet travel scheme is for. So it is purely to keep track of movements of cat, dogs and ferrets. So hopefully to try and reduce sort of illegal importation, keep track of where pets are going. The only other purpose it serves is to reduce the risk of zoonotic pathogen spread. And it will only put legislation on the pet travel scheme if there is a certainty, or an all but certainty, that those legislative differences will have an impact on disease transmission. So, there's been lots and lots of talk about what we should introduce on the scheme, what we shouldn't introduce on the scheme. Well, it isn't even worth considering introducing it if it doesn't have a zoonotic aspect that's very significant, and if you don't have a very practical single method for containing it that you can add to the scheme. So if you're lobbying to change the current pet travel scheme, what rules we have for our own importation as part of a trade agreement is something else. But if you're lobbying for the pet travel scheme itself, those are the two most important things. And I think cats and dogs have had a pretty hard deal, really, all in all. There's lots of legislation around economically important animals because they're economically important. There's lots of legislation around zoonotic risk, but cats and dogs often, almost always in fact, fall in between those two posts, and therefore there's very little protective legislation for them at all. So at the moment it's still the same. We still need a microchip before we do anything else, and vaccination against rabies. You still need a current EU pet passport. That is very likely to change at the end of the year. It's very likely that we'll go over to some form of a temporary certification, unless we remain members of the scheme. We still need travel with an approved transport company, an authorised route. So there are examples of those on the gov.uk website if your clients are unsure. And crucially, we still have this compulsory tapeworm treatment before entry back into the UK, 1 to 5 days before entry, unless that travel is from Ireland, Finland, Norway or Malta. So we can all move around those countries without any to get compulsory tapeworm treatments at all. As soon as we move outside them, we need that compulsory tapeworm treatment.